Have you ever wondered if the tests you're still ordering might actually be doing you more harm than good? It sounds unbelievable, but some of the very health screenings we once relied on could now be leading us down the wrong path. In fact, there are a handful of medical tests that become not only unnecessary, but potentially harmful after a certain age. This doesn't mean giving up on your health. Quite the opposite. It means learning how to protect yourself not just from illness, but from overdiagnosis, fear-based decision-making, and needless procedures that can quietly steal your peace of mind, your independence, and sometimes even your life. In this video, we're going to talk about 5 specific health tests that many seniors are still being pushed to take, even though mounting evidence shows that they may do more damage than good after 70. These are not random guesses or conspiracy theories. They are patterns identified by experienced physicians, studies from major medical institutions, and even stories from seniors who've lived through the stress of being over-tested. Now let's begin. Number 1, PSA testing for prostate cancer after 70. One of the most commonly ordered tests for men over 50 is the PSA test, a simple blood test, designed to detect prostate cancer early. For many, it has been a routine part of yearly checkups, a reassuring number on a lab report. But when men pass 70 continuing, this test without careful consideration can lead to more harm than good. The problem lies not in the test itself, but in what happens afterward and how it can trap seniors in a cycle of unnecessary procedures and side effects. The PSA test measures prostate-specific antigen, a protein produced by the prostate gland. Elevated levels can indicate prostate cancer, but they can also be caused by benign conditions, like inflammation or enlargement of the prostate. This test is notoriously prone to false positives, meaning many men receive alarming results that don't actually reflect dangerous cancer. This leads to follow-up biopsies, which carry risks of infection and bleeding, and sometimes to treatments like surgery or radiation that can cause incontinence and erectile dysfunction. For men over 70, many prostate cancers grow so slowly, they would never cause symptoms or shorten life expectancy. Detecting these cancers often leads to treatments that impair quality of life without meaningful benefits. Studies have shown that PSA screening in older men can increase anxiety and medical complications, without reducing deaths from prostate cancer. Consider the story of James, a 74-year-old retired teacher, who had been getting annual PSA tests for years. When his levels spiked, he underwent a biopsy that revealed a low-risk tumor. Faced with treatment options, James chose surgery. While the cancer was successfully removed, he spent months dealing with urinary incontinence and lost the ability to enjoy intimacy with his wife. His quality of life suffered, and he wondered if the treatment had been worth it. Medical guidelines now recommend that men over 70 discuss the benefits and harms of PSA screening carefully with their doctors. Many experts advise against routine PSA testing in this age group, unless symptoms are present. Instead, a personalized approach that weighs overall health, life, expectancy, and patient values is essential. The goal is to avoid harm from unnecessary testing and treatment, focusing instead on comfort and well-being. So if you're over 70 or caring for someone who is, remember that more testing is not always better. PSA screening can cause more worry and damage than relief. The best test might sometimes be a thoughtful conversation, not a needle or a lab report. Protect yourself by asking your healthcare provider if PSA testing is truly necessary for your individual situation, because sometimes saying no is the smartest choice you can make. This is not about neglecting health, it's about choosing wisely. Because after 70, what matters most is living well, not just living longer. Number 2, routine colonoscopies past 75. For decades, colonoscopies have been championed as the gold standard for detecting colon cancer early. And for good reason. When done at the right time, they save lives by catching dangerous polyps before they turn malignant. But after 75, especially for those with a history of normal screenings, the benefits of routine colonoscopies start to diminish, and the risks begin to rise significantly. A colonoscopy isn't just a quick peek inside your intestines. It's an invasive procedure that requires bowel preparation, sedation, and the insertion of a flexible tube through the entire colon. For seniors, this process carries higher risks: bleeding, bowel perforation, adverse reactions to sedation, and even hospitalizations. And while the odds of colon cancer increase with age, the procedure's complications become more dangerous as your body's resilience declines. Many older adults aren't aware of this delicate balance. They assume more testing is always safer, But the reality is that colonoscopies after 75 can sometimes do more harm than good, especially if you have other health issues or frailty. For many, the chance of finding a story, slow-growing polyp that wouldn't impact their lifespan is high, but the chance of complications from the test is also elevated. Take the case of Margaret, an 80-year-old grandmother, who dutifully scheduled a colonoscopy every 5 years. Her last test was clean, but her doctor recommended another screening just to be safe. During the procedure, a small tear occurred in her colon wall, leading to hospitalization and weeks of recovery. The injury didn't cause cancer, but it did cause pain, fear, and a loss of independence. Margaret's quality of life was compromised, not by cancer, but by the very test meant to protect her. Because of these risks, many medical organizations suggest stopping routine colonoscopy screening at age 75, especially for those in good health with previous negative results. Instead, doctors recommend focusing on symptom awareness, like changes in bowel habits, blood in the stool, or unexplained weight loss as triggers for evaluation, rather than blanket screenings. No one wants to gamble with their health, but sometimes the safest bet is to say no to unnecessary tests. After 75, your health priorities shift from aggressive screening to protecting your quality of life. That means choosing tests that help you without putting you at undue risk, and being wise about when and why you undergo them. This isn't about fear, it's about knowledge. It's about respecting your body's changing needs and making decisions that honor both your past health and your future comfort. Because your years after 70 are precious, and how you care for yourself should reflect that. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Number 3, full-body CT scans without symptoms. In today's high-tech medical world, it's tempting to believe that more imaging is better. More pictures, more data, more peace of mind. Full-body CT scans promise to catch diseases early, sometimes even before symptoms appear. But when it comes to seniors over 70, routine, full-body scans without any symptoms can be a double-edged sword, often causing more harm than good. These scans expose your body to significant amounts of radiation, far more than a standard X-ray. Over time, this radiation can increase the risk of developing cancer, ironically, the very condition these scans aim to detect early. But the bigger problem lies in the incidental findings, the unexpected spots, nodules or shadows that show up on scans but are harmless or slow-growing. When a doctor spots something unclear, it often triggers a cascade of follow-up tests, biopsies or treatments that may carry serious risks, or cause anxiety without clear benefits. For many older adults, the likelihood of discovering such incidental findings is high, simply because of natural age-related changes. This can lead to what's called overdiagnosis, finding and treating conditions that would never have caused harm. The mental toll alone, constant worry, repeated hospital visits, invasive procedures, is substantial. And that's before considering the physical toll of complications. Take Martha, a lively 76-year-old woman who underwent a full-body CT scan during a routine health check. The scan revealed a small lung nodule. Despite reassurances that it was likely benign, doctors recommended a biopsy. The procedure led to complications, including bleeding and hospitalization. Martha spent weeks recovering and was left more anxious than ever. The nodule never developed into cancer. Her scan led her down a path of unnecessary interventions. Medical experts increasingly warn against using full-body CT scans for healthy seniors, without specific symptoms or risk factors. Instead, screening should be targeted and personalized, focusing on tests with proven benefits and acceptable risks. This approach avoids the emotional and physical harm caused by chasing shadows that may never turn into disease. If you're over 70 and considering a full-body scan, ask yourself and your doctor, what am I looking for? How will this change my treatment? What are the risks? Sometimes, the best answer is to monitor symptoms and maintain regular doctor visits, rather than pursue every possible scan. Number 4, annual chest X-rays for lung cancer screening in non-smokers. Many older adults, especially those who have never smoked, are routinely advised to undergo annual chest X-rays as a precautionary measure against lung cancer. It sounds reasonable: catch cancer early, treat it early, save lives. But for seniors over 70 who do not have a significant history of smoking or lung disease, routine chest X-rays often do more harm than good. Chest X-rays are a limited tool for lung cancer detection, especially in asymptomatic individuals. They can miss early-stage cancers and often detect harmless abnormalities that lead to a series of unnecessary follow-up tests. These follow-ups might include CT scans, biopsies, or even surgeries, each carrying risks of radiation exposure, infection, and complications from invasive procedures. For many non-smokers, benign lung nodules or scars from past infections are common and harmless. Yet when an X-ray flags these incidental findings, they can trigger a cascade of anxiety, invasive testing, and overtreatment that reduce quality of life. The psychological impact of false alarms is often overlooked, but can be profound, causing stress and fear that persist long after the tests are complete. Consider Helen, an 82-year-old retired librarian who underwent yearly chest X-rays as part of her routine health checks. After one such scan revealed a small shadow, she was referred for multiple scans and a biopsy that caused pain and complications. Ultimately, the shadow was benign. However, the emotional toll and physical discomfort she experienced were real and lasting. Leading health authorities now advise against routine chest X-rays for lung cancer screening in low-risk older adults. Instead, they recommend targeted screening for high-risk individuals, primarily long-term smokers or those with a history of heavy exposure to environmental hazards. For the majority of seniors who don't fit this profile, routine X-rays offer little benefit and carry significant potential for harm. This is a critical distinction. It's not about avoiding necessary care, it's about avoiding unnecessary harm. When it comes to lung cancer screening, more is not always better. The best approach is personalized care that balances risks and benefits according to your specific health history. Before agreeing to routine chest X-rays, ask your healthcare provider, what's the likelihood this test will benefit me? What are the risks? Is there a less invasive or safer alternative? Being informed empowers you to avoid unnecessary procedures that can disrupt your peace and well-being. Protecting your health after 70 means making thoughtful choices about which tests are truly needed and which can be safely avoided. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Number 5, routine cognitive testing without symptoms. Many seniors find themselves facing a barrage of cognitive tests during doctor visits, even when they show no real signs of memory loss or confusion. While screening for dementia and cognitive decline is important when symptoms arise, routine cognitive testing without any warning signs can lead to unnecessary fear, stigma, and sometimes even misdiagnosis. For those over 70, this kind of overtesting can do more harm than good. Cognitive tests are designed to detect early signs of conditions like Alzheimer's disease. But without symptoms or noticeable changes in daily functioning, these tests often pick up normal variations in memory and thinking. Aging naturally comes with some slowing of processing speed and occasional forgetfulness. When these normal changes are labeled as impairments, seniors can feel discouraged or anxious about their mental health, even when no serious problem exists. The emotional impact can be profound. Imagine being told you might be on the path to dementia based on a screening test, without any real evidence of decline. This can lead to increased stress, depression, and social withdrawal, factors that ironically contribute to cognitive difficulties over time. Moreover, without effective treatments for early-stage cognitive decline, the benefits of widespread screening in asymptomatic seniors are limited. Take Sarah, a 75-year-old retired nurse who went for her routine checkup and was given a battery of cognitive tests just to be safe. The results showed mild memory lapses, which her doctor interpreted cautiously. However, Sarah left feeling worried and confused, second-guessing every memory slip. Her anxiety increased, and she became hesitant to engage in social activities she once enjoyed. Months later, a specialist reassured her that her test results were within normal limits for her age, and that her memory changes were typical aging, not disease. But the stress she experienced in the interim was very real. Experts now recommend that cognitive testing be reserved for seniors who show signs of memory loss, confusion, or difficulties with daily activities. For healthy seniors without symptoms, routine cognitive screening can cause more harm than reassurance. Instead, maintaining a healthy lifestyle, staying socially engaged, managing cardiovascular risk factors, and engaging in mentally stimulating activities remain the best ways to protect brain health. It's essential to remember that aging brains vary widely. Some people maintain sharp thinking well into their 90s without formal testing. Others may experience gradual decline that doesn't fit typical patterns. Personalized care and watching for genuine signs matter more than blanket testing. So, if you're over 70 and feel fine, don't let routine cognitive testing shake your confidence or define your future. Instead, focus on what truly supports your brain and your well-being: connection, nutrition, activity, and joy. Remember, not every test is a tool for health. Some tests, when done without clear reason, can cause more worry than help. Protect yourself by understanding when tests are necessary and when they are best avoided. Final thoughts. As we wrap up this important conversation, remember that aging is a unique journey for each of us. The tests and screenings that once seemed essential can change in their value as we grow older. What matters most after 70 is protecting your peace of mind and focusing on quality of life rather than chasing every possible health scare. Being wise about which medical tests to take and which to avoid is a powerful way to stay in control of your health and happiness. It's not about neglecting your care. It's about embracing thoughtful, personalized decisions that honor your body and your future. Think about your own health journey. Are you taking tests because they truly help you or simply because they've become routine? It's okay to ask questions, to seek second opinions, and to prioritize comfort and well-being over unnecessary procedures. Your time and energy are precious, and the best gift you can give yourself is a balanced approach that supports your vitality without adding stress or harm. Thank you for trusting us with your attention today. We'd love to hear your thoughts. Leave a comment below about one insight you found valuable and how you plan to use it in your life. Your experiences and perspectives mean the world to us, and sharing them helps build a caring community where we all grow stronger together. If you found this video helpful, please like, subscribe, and share to help us keep bringing you thoughtful, empowering content. Your support encourages us every day. Here's to living well, making wise choices, and cherishing every moment of the years ahead. Thanks for watching, and we look forward to seeing you in the next video.